I know it's been a minute. Uh, Please forgive us for being away for a few weeks. Things got busy in November with work and with conferences and with family. So we're here for you in 2023. So this is our presentation in the series of Affairs of the Heart. I have lost track of which number we're at, but we're at peripheral arterial disease. So let's go. So peripheral arterial disease is a pie problem. The outline for Affairs of the Heart is as listed here. We're at number 6, right? Peripheral arterial disease, to be followed by valvular heart disease next week, and then subsequently by chronic venous insufficiency and lymphedema. So, and thus far we've discussed the age-related changes of the cardiovascular system, hypertension, heart failure, coronary artery disease, and arrhythmias. Feel free to visit our YouTube page to see those previous presentations. So in this presentation, as usual, we discuss the GeriTips, facts, and trivia. And then we discuss what peripheral arterial disease is, why is it so important, the causes of peripheral arterial disease, symptoms and signs of peripheral arterial disease or PAD, how it's diagnosed, and how to treat, prevent peripheral arterial disease. And I think there may be some role for reversal depending on how early intervention takes place, and then we'll end with some resources. So peripheral arterial disease is a type of vascular disease, and it presents in 10% of people above the age of 55, and it really is when peripheral arterial disease is present, it's almost a certainty that that same person will have coronary artery disease, because if there's blockage in the peripheral arteries, i.e. the arteries of the legs and the arteries in the abdomen, etc., there is blockage of the arteries in the heart. So 1 in 3 persons with diabetes has peripheral arterial disease. Of note, Ella Fitzgerald had both legs amputated in 1993 due to her, she had diabetes, and unfortunately she died 3 years later. So just to go through once again the anatomy and the physiology of the cardiovascular system, just specific to peripheral arterial disease. So blood that has oxygen will leave the left side of the heart, labeled L, and go to the legs, and this blood travels in arteries, and then the arteries break up into arterioles, and then the arterioles will break up into capillaries, and then the capillaries will deliver blood to the tissues of the legs, the muscles, the nerves, you name it, and then blood will leave the legs in the form of venules, and this blood is devoid of oxygen, or has little oxygen because the oxygen has been used by the tissues, and the blood looks blue because of the loss of oxygen, and the venules become veins, and the veins will deliver this deoxygenated blood to the right side of the heart. The right side of the heart, labeled R, will deliver blood to the lungs, where the lungs will deliver oxygen to that blood, and the blood becomes oxygenated, and the cycle continues. Now, unfortunately, in the legs, because the leg is in most people the furthest away from the heart of all the limbs, of all the parts of the body, its blood supply is somewhat tenuous. So when there is blockage of these arteries due to cholesterol plaques, due to damage done to them by smoking and other things, it's relatively easy, for the blood flow to be compromised to the legs. and we'll see what symptoms and further complications can happen when the blood flow to the legs due to blockage of arteries and arterioles, what that can do to someone. All right, now as we mentioned before, with age there's less efficient blood flow to the heart. Blood become calcified, heart muscle become weaker, lung muscle become weaker, arterial wall becomes stiff, and conduction tissue diminishes. And that's just a general comment. Now, peripheral arterial disease is defined as the changes that result from insufficient arterial blood flow to the lower extremities. Sometimes you hear about peripheral arterial disease in the upper extremities, but because the upper extremities are closer to the heart, the upper extremities tend to have good blood flow. Now, risk factors: the older we get, the higher the risk of peripheral arterial disease. Hypertension also can contribute to this type of disease. That hypertension damages the lining of the arteries. Tobacco use is definitely toxic to the lining of the arteries. The tobacco and the chemicals related to tobacco use tend to damage the lining of the arterial walls and impair the function of the arteries. The arterial walls, the inner lining of the arteries help to determine the size and the diameter of the arteries and help to regulate the blood flow to different parts of the body. Same thing with diabetes. Diabetes damages the lining of our arteries, and high cholesterol also. So these are the risk factors for peripheral arterial disease. And then a lot of people will have peripheral arterial disease and not have any symptoms, but for persons who do have symptoms, they can have cramping in the buttocks and the hip and the thigh and the calf. And this pain classically gets worse with exertion and improves with rest. That is the classic pattern of peripheral arterial disease. And then as the peripheral arterial disease progresses, persons will have pain even at rest, and that indicates advanced disease. And then beyond that, because of blood flow compromise to the skin becomes ulcerated, and then at the last stage there's complete death of the tissue in that area, and then person will present with gangrene of the toes and parts of the foot, which would necessitate amputation of that area. So in terms of physical exam, if you were to go, if a person with peripheral arterial disease were to visit a physician, and or the medical team would note loss of tissue in that area, non-healing ulcers and gangrene, and then the pulses would be diminished in those areas as well. If there is a suspicion of peripheral arterial disease, there's a test called an ABI, which stands for ankle brachial index, which is a comparison of the blood pressure in your ankles with the blood pressure in the arm. And if it's below a certain number, it's diagnostic of peripheral arterial disease. If it's above a certain number, it's diagnostic of a peripheral arterial disease. If it's in between, further testing needs to be done. And then in persons who are found to have peripheral arterial disease, duplex ultrasound can help to look on the veins to see if they're okay. CT angiogram and other types of angiography can be used to determine the extent of the presence of peripheral arterial disease. So basically, peripheral arterial disease is something that many of us have without symptoms, but for those who have symptoms, the symptoms really are in the form of cramping with exertion in the lower extremities. And there is testing that can be used to diagnose peripheral arterial disease. If the diagnosis is made, here are some tips in terms of how to treat and prevent peripheral arterial disease. 1, eliminate alcohol from your diet. 2, eliminate tobacco from your diet. Eliminate tobacco. 3, eliminate tobacco. 4, eliminate tobacco. Beyond that, consider a whole food plant-based diet, because whole food plant-based diets are rich in chemicals and nutrients that can help to heal the body. Antioxidants. And a whole food plant-based diet refers to a diet that's plant-based, but it's not a plant-based diet that's processed. So there are a lot of products out there on the market that are plant-based, but they are heavily processed. So we're talking about the simple foods from nature that are really plant-based. Consider those foods, and the regular exercise can help to restore blood flow to those areas that are yet to have gangrene and yet to have skin ulceration. So these are the primary tips to treat and prevent peripheral arterial disease. If you catch it early enough, if you don't have any symptoms, you may be able to even reverse peripheral arterial disease by adopting a whole food plant-based diet and avoiding toxins such as alcohol and tobacco. And that's it. So thank you so much for your time, and we hope to see you again on GeriTips. Take care. Bye bye.